Without conscious care, you and your partner could be vulnerable physically and exposed to a number of sexually transmitted infections. In today's episode, we'll be talking about STIs and what you can do to prevent them. I'm Dr. Freddy Gomez, and welcome to Medtalk Healthtalk on CNN Philippines. Our guests are here today to give insight on sexually transmitted infections. With us is Dr. Valiant C. He's an OB gynecologist and infectious disease specialist from the Makati Medical Center and a fellow of the Philippine Obstetrics and Gynecology. Also with us is Dr. Jejuni Rivera. He's an infectious disease specialist and public health specialist from Zamboanga Doctors Hospital and a fellow of the Philippine Society for Microbiology and Infectious Disease. Now, we'll start with Dr. Juni. Doc, what are some of the sexually transmitted infections na prevalent, lalo na dito sa Pilipinas?
Prevalent in the Philippines are gonorrhea, yung mga urethritis, ibig sabihin, there's an inflammation of the tube where the urine passes that can be caused by many infections like gonorrhea, chlamydia, ureaplasma, syphilis, also very commonly seen. We also have herpes, HIV, hepatitis B, and hepatitis A is also a sexually transmitted disease because of our practices.
Marami talagang STIs ang pwedeng makuha ng mga Filipinos. Now, I'd like to ask Dr. Val naman, do the symptoms vary in each STI?
Since I'm an obstetrician gynecologist, I mostly see female patient and pregnant patient. Majority of them, the first chief complaint is usually pelvic pain, which is masakit yung puson, and the other is usually abnormal vaginal discharge. But from there, you can reassess them and evaluate them kung anong specific na STI yan.
Meron bang STI na walang symptoms na pinapakita? Walang symptoms na mararamdaman?
Actually, there's not such thing as there's no symptom, but the symptom was not, hindi nila napapansin. Then it's apparently, when you tested blood test for STI screen, then napapositive sila. And apparently, they are asymptomatic.
Now, Dr. Juni, do you believe that there is still some form of stigma surrounding STIs? How does this affect people seeing a doctor for their infections or seeking consult, especially for that first time?
There's a lot of stigma around sexually transmitted infections because of our culture. We seem to be not very forgiving about sexually transmitted infections. And so what people do is they keep it to themselves and they come to the doctor when the symptoms are really severe. So like for example, if it is urethritis or gonorrhea, sometimes it will take for male patients to come to the clinic after 3 to 4 weeks. And there's a lot of discharge already coming out from the urethra, from the head of the penis also. And so we are able to treat late sometimes because of stigma. They're afraid that they will be scolded by the doctor, but that's not how it is.
Now, it goes without saying that people who have unprotected sexual intercourse are more likely to contract STIs, but some are at higher risk compared to others. Dr. Juni, are there other risk factors or pre-existing health conditions for STIs?
It's basically behavioral. The risk factors for sexually transmitted infections are because of unprotected sex primarily. And if you have more sexual partners, then you are more likely to have sexually transmitted infections also compared with those who are monogamous or who only have one partner. And if you don't use condom, barrier methods for protecting yourself and others from STIs, then you are at risk for having STIs. There are also other practices of men having sex with men increase the risk for HIV and many other sexually transmitted infections. And that is why these practices have to be protected.
Dr. Val, when infected with an STI, could you talk about some of the complications that this may lead to if someone is infected? How bad can it get, kumbaga?
If you have an STI and you're pregnant, obviously the STI might infect the unborn children. So for example, in syphilis, it can cause congenital abnormalities of the baby. In HIV, obviously, we know that when the mother is infected with HIV, it's not properly managed. Obviously, the unborn child, when get delivered, might have a chance to become an HIV positive during the first day of her life. Now, when it's non-pregnant, usually in female patient having STI repeatedly, untreated, or even treated, but nauulit, nakakaroon, the chances of infertility is high. Destruction of the organs dun sa mga uterus and ovary na destroy or chronically infected, nasisira. So eventually, you have a long-term problem of unable to get pregnant in the future, or some of the cases, worse, if it gets severely infected, na hindi na kaya ng medical management, you need to surgically remove it. And obviously, when you have the uterus or ovaries removed, you cannot get pregnant in the future.
Dr. Val, how about cancer? Are there STIs that are known to lead or be precursors for cancer?
For the different STI, the more common that is can prone to develop cancer is the HPV infection, the human papillomavirus infection, which is prone to infect the cervix of the patient that can lead to cervical CA. Hence, screening is very important. The other one is the hepatitis B infection. Hepatitis B infection is actually an STI, blood-borne infection that can attack the liver and can cause liver cancer. That's the two more common STI that can lead to cancer. The other naman, it's not that common.
So there you go. So there is also a risk for that. Now after the break, we'll discuss preventive measures that you can do to make sure you and your partner are safe from STIs. Only here on Medtalk Health Talk. I'm Dr. Freddy Gomez and welcome back to Medtalk Health Talk on CNN Philippines. Now there are many ways to ensure that you and your partner are both safe from infection when engaging in sexual activity. Dr. Junie, let's talk about the most accessible form of protection, condoms. Can you discuss the effectivity of these as well as the availability?
Condoms are readily available elsewhere. We have them in the gas stations, stores, no? We have them in groceries. They're everywhere already. We have them in pharmacies as well. So it can prevent most infections. It's a very good barrier method for preventing infections as well as pregnancy in women. And it is very effective. It is highly effective. When we're talking about other sexually transmitted infections such as HIV, the most important factor really is educating people, especially younger people, because at this time, the group that is second most affected among people infected with HIV are the age group 15 to 24 years old.
Speaking of HIV, there is a medicine that is said to reduce one's chance of getting HIV. Is there any, can you talk about this a little bit?
Yes, there's what we call a pre-exposure prophylaxis for HIV. And that effectively prevents people from having HIV infections as well. If they engage in risky sexual practices, people can have pre-exposure prophylaxis medications, and those are the same medications being taken by people living with HIV that prolong their lives. However, there's also a risk of taking pre-exposure prophylaxis if we are unable to address our behavior, because there are still many other infections that can infect us.
Does something as simple as having proper hygiene help in avoiding some STIs?
Proper hygiene is obviously a basic practice, but in terms of decreasing the risk of STI, I don't think so. It may contribute to decrease somehow, but because it's usually a proper hygiene practice only, not exactly that you're unhygienic that you develop STI. What can I advise to my patient to prevent that you have performed a high-risk act? You might as well do early screening, and this is part of early prevention.
There are vaccines for some of the viruses that you might contract through sexual intercourse. Dr. Junie, can you identify which STIs already have vaccines?
There's a vaccine for hepatitis B, there's a vaccine for hepatitis A, there's a vaccine for HPV. And the OB gynecologists really give a lot of HPV vaccines to younger women, and I'm very happy with that. It should be part of a national program already to vaccinate all reproductive age women, younger reproductive age women.
How accessible are these vaccines?
Actually, it's widely available, but it's might somehow expensive. But there are cheaper ones, especially for the HPV, kasi presently they have the 8 strain, the latest strain that's the more expensive. But if the patient cannot afford, you can still do the previous strain, the 2 strain and the quadrivalent strain, which is much more cheaper. But both of them can protect you from HPV because in particular, ang habol natin from the vaccine for HPV is not also for the prevention of the STI, but the prevention of the progression to cancer. As I said earlier, that HPV can lead to cervical CA. So
Okay.
giving the vaccine not exactly for the younger age group, even for the older age group, basta hindi pa siya na vaccine, can help to prevent the development of cervical CA.
How long do they last in providing us with immunity? So na yung ating mga viewers na may mga booster dose lately. Kailangan din naman ng mga booster dose when it comes to the STI vaccines.
Yung hepatitis B vaccine is given in 3 doses and then you get a booster dose later. But the 3 doses should be already enough. The HPV vaccine is also given as 3 doses, but and as well yung hepatitis A naman. But they're known to have a long-lasting effect. No? And remember that when we are given vaccines, our memory cells in the body will always remember exposure to the vaccine, which is similar to a component of an infecting agent. No? So, maaalala niya yun when the time
Okay.
comes that there is an infection that's coming into the body and we'll be able to stop that infection. And that stays with us for our lifetime. Although, there is what we call waning immunity pag nagkaroon ng immunosuppression or hihina yung immune system ng tao. But it doesn't happen in general.
Now, Dr. Val, can you walk us through how one can get tested for a sexually transmitted infection?
Usually screen them, usually blood tests. You can screen for serum RPR for syphilis, serum hepatitis B testing, and HIV testing. Now, for the gonorrhea and chlamydia, usually there's 2 blood tests, but usually you do the swab. Ito parang swab test sa COVID, but ito you do the swab in the fluid, in the discharge, that you can send it to test whether the patient is positive chlamydia or gonorrhea. Those are the more common tests that's available in our country.
So if by any chance you become infected with an STI, always connect with your physician first to take necessary actions for these infections. When we return, we'll talk about possible treatment and management options of sexually transmitted infections. So keep it here, only on Medtalk Health Talk. I'm Dr. Freddy Gomez and welcome back to the show. We have been discussing sexually transmitted infections or STIs and the initial steps to take if by any chance you get infected. Now let's talk about treatment and management for these STIs. Dr. Val, can you walk us through some of them, the ones that you more commonly see in your practice, especially when it comes to women who are infected with STIs?
So when the patient is infected with STI, came to you for screening and you assess them and screen them positive for STI, you immediately treat them. Okay? And the treatment in general for the different STI is quite easy and outright na you just give antibiotic. It may be given in the injection form or oral form, that take it for 1 to 2 weeks, then you reassess it. Most of the time when you reassess it, it's usually resolved. Okay? Cases that are not resolved, most of the time is usually reinfection. So also remind them that while on treatment, practice abstinence. Do not do intercourse yet. Then after treatment, when you screen them na okay na sila, then next you can advise them that they can resume intercourse, but always practice with preventive measures.
Dr. Julie, could you tell us the risks involved for someone who self-medicates, who looks up on Google how to treat their STI? What are some of the risks involved with this?
Most of the important risk factors there would be emergence of resistant microbes because of undertreatment or improper treatment. And we are seeing that already elsewhere in the world, no, including here in Zamboanga. We used to only give 250 milligrams of ceftriaxone as an injection to people who have gonorrhea. Now, there are some patients who after giving a shot of ceftriaxone, hindi na gumagana, so they come back. They tend to tell us that nothing happened after they were treated, but they seem to have an infection ongoing. And so, what we do now is we also use the European Protocol for Treatment of Gonococcal Infections, no, yung gonorrhea. So we give 1 gram of ceftriaxone along with 2 grams of azithromycin. The azithromycin is also good. It can be given along or alternatively with doxycycline because along with gonorrhea, there may be other co-infections, no, such as chlamydia or urea plasma, and this can be treated with azithromycin, but not ceftriaxone. So there are also orally available antibiotics. I hope nobody sells antibiotics anymore without the doctor's prescription, such as cefixime, and the patients can really also be given alternatively with cefixime. However, there is a risk for resistance to cefixime already. That is why what is recommended now for gonorrhea is really injections.
Are there any STIs where surgical management, surgical procedures is an option for that? Or can most STIs be treated medically?
Most STI in general can be treated medically. Given proper antibiotic, proper dose, and proper follow-up, completion of the dose, we can treat it. Now, for STI for surgical approach, usually the only one that is common, it's the genital warts, okay? That's caused by human papillomavirus. Usually genital warts, we can treat it medically, but most of the time, we need to do surgical removal in the term of electrocautery to eradicate those lesions because those are bothering. Other than that, most of the time, they can manage medically.
Thank you so much, Dr. Valiant C. and Dr. Jejuni Rivera for being with us today. Madami talaga tayong natutunan, especially when it comes to STIs. So thank you for sharing your expertise. And to our viewers, remember that health professionals are here to help you when you are dealing with STIs. I'm Dr. Freddy Gomez, and thank you for watching Medtalk Health Talk. We'll see you again next time.